So welcome. Tonight, we're going to talk about pelvic floor therapy for pregnancy and postpartum moms. So during pregnancy and childbirth, a woman's body will go through many physical changes, as evidenced in this diagram. The presentation tonight will review the physical changes that are expected and provide tips to help you keep feeling your best during pregnancy and the postpartum period. Let's first look at this diagram, which basically shows us the changes in a pregnant woman's body. So pre-pregnancy, 20 weeks, 40 weeks, and 40 weeks internal and external. A lot of growth during that time. So the body changes quite a bit, and to support the growing baby, the diaphragm pushes up, the ribs spread out, the abdominal wall is stretched, and there's an increase in the pressure on what we call the pelvic floor. We anticipate a weight gain of about 20 to 40 pounds. The uterus grows 10 times in weight. Your blood volume increases by about 40%, and your body burns an extra 300 kilocalories per day. The pelvis becomes more flexible, and the tilt in the pelvis increases. The center of gravity changes, and gait becomes more like a waddle to accommodate for that. And then the low back curve flattens. All of these changes can lead to weakness, pain, and dysfunction for the mom after the baby's born. And while these changes are common, they're not necessarily normal. So before we go any further in our discussion, we need to discuss and understand the definition and the function of the pelvic floor and the core. So the pelvic floor is 3 layers of muscles, tissues, nerves, and vessels that extend from the pubic bone in the front to the tailbone in the back, and from one side of your butt bone to the other. Let's see if I can get my laser here. So if we look at that, this would be the pubic bone in the front to the tailbone in the back. This is your pelvic floor muscle. The pelvic floor is involved in bowel, bladder, and sexual function. And the urethra, the vagina, and the rectum have an opening in the pelvic floor. So if we look at these pictures, we can better see this would be a superior view looking down into the body. And here you can see urethral, vaginal, and rectal opening. And that's looking down into the body. And then if we looked up underneath the body, so an inferior view, same thing, this would be the urethral opening, vaginal opening, and rectal opening. And you can see how expansive the muscles are, again, running from pubic bone to tailbone and from one side to the other. The abdominal wall is 4 layers deep. The rectus is that pretty 6-pack that we see. And then underneath that, we have the obliques, followed by the deepest muscle, the transverse abdominis. The linea alba is that tissue that runs down the middle and holds the 2 sides together. And if we look at the pelvic floor, the abdominal wall, the back muscles, and the diaphragm, so abdominal wall, pelvic floor, the back muscles known as the multifidi, and the diaphragm. If we look at those all together, that is what makes a core. And so when those muscles are working well together, that core is strong and it produces good balance, posture, and stability. So I always use this soda can analogy because it makes it a little easier to understand. But if we take this core and we compare it to a soda can that's full, so it has good pressure, there's no dents, it's not crunched or anything, it's very stable and looks great, right? And then what if we started to put a dent in the can or we started to crush it? We would lose that stability that we had. And so that's analogy to what happens during pregnancy and postpartum. And if we talk about the pressure that's in the can, that's very similar to the intra-abdominal pressure that we have in the abdomen. So when you have a strong core or a stable soda can, your pressure is equal and it's well maintained, just like the balloon in this picture. If we would push downward on this balloon or bend forward, the pressure would increase on the pelvic floor. And that would probably, if we had a weak pelvic floor, make us leak urine. If we had a cut in the balloon or an incision, it would make all of the core muscles feel weak. So they wouldn't function as well as they did prior to a cut or a slit in the balloon. And we'd lose that normal pressure. So there would be an imbalance. When it comes to the core, you're only as strong as the weakest link. So one of the exercises that we do to really help our core and stabilize our core is simply diaphragmatic breathing. So if you're sitting where you are right now and you want to practice this very quickly, you're just going to take a slow breath in through your nose and fill up your belly and your abdomen with air. So you should feel like your abdomen extends forward as you breathe in through your nose. And then as you exhale through your mouth or pursed lips, you're going to contract your abdomen towards your spine. So I always say, take your belly button towards your spine and exhale, get all that air out. So you can feel your muscles working as you do that. So during pregnancy, abdominal and pelvic floor muscles are stretched up to about 250% of their normal length. The muscles then return to an optimal length at some point, but for many, persistent diastasis or separation is the result, and it can make you feel weak, can cause shortness of breath, make you feel nauseous, have you sit or stand in a poor posture, and you might have difficulty just breathing. And with a C-section incision on top of that, you add more of a forward tilt with the trunk and maybe become more of a shallow breather or have difficulty catching your breath at all. This is what a diastasis looks like. So it can be around the navel. It can be a kind of open-ended diastasis where it's throughout the upper and lower part. It can be just above the navel, and it can be just below the navel. And then in terms of a diastasis or a separation between those abdominal wall muscles at the linea alba, so this would be a normal abdominal wall anatomy, someone laying on their back, and we cut through the abdomen. And here we can see that muscle and then the linea alba. In a diastasis, there's a separation here where the linea alba has thinned and the muscle has pulled away. Think of this with pregnancy. When the belly's growing and stretching, that muscle separates and leaves the linea alba to thin. You can see in this picture, a person is doing a little crunch or a little sit-up, and you can see how that pushes up on the linea alba. So the prevalence of diastasis, 30% of pregnant women have it by the second semester, 66 to 100% by the third trimester, and about 100% by the end of the third trimester. Risk factors are always age, so the older you are, the worse it is, number of pregnancies, bigger babies, greater weight gain, and C-sections. Those would be the things that definitely lean towards earlier diastasis. Surprising symptoms with this are things that we typically don't associate with that. So pain in the abdomen, pelvis, or the low back, incontinence, prolapse, poor posture, and just a generalized feeling of weakness. So we're going to talk a little bit more about the core and establishing or restoring core function and strength. So as we talked about, the core is essential for stability during most of our activities, things like lifting your baby, getting in and out of bed, and performing exercise. After pregnancy and childbirth, the abdominal wall is stretched and weakened. And this module that we're going to go through next is going to teach you some best practices for restoring the core so that you can feel confident and strong. So you can do exercises, but you need to make sure you do them correctly. And the primary thing is don't strain and don't hold your breath. This is a typical abdominal exercise that we do, just like we just did with the breathing exercise. So you're going to start by sitting and you're going to take a belly breath in. So again, breathe in through your nose, allow the belly to relax. And then as you exhale, you're going to do a shush, or you're going to actually purse your lips and blow the air out, drawing your belly button towards the spine. You want to try and hold that belly button in for a count of 3 to 5 seconds and repeat that 10 times. We typically tell people to repeat it 3 to 4 times a day. As you advance, you can start to do motions with your arms and your legs to make it harder for you to be able to hold that belly button in. So it's just more challenging. In terms of pelvic floor exercises, there's some basic ones that we can do. So we'll start with pelvic floor coordination. Again, if you breathe in through your nose and fill up your belly with air, as you breathe out through your pursed lips, you're going to squeeze and lift your pelvic floor muscles. Probably heard of a Kegel or a tightening of the pelvic floor. When you do a tightening of the pelvic floor muscles, you feel like you're trying to stop the flow of urine or stop the passage of gas. Then you're going to drop, relax your pelvic floor, and take another breath in. Repeat that 10 times. So those short, quick exercises help with the coordination of the muscles. Quick flicks, you're going to squeeze and lift your pelvic floor muscles. So now you're tightening your pelvic floor and then just dropping and relaxing it. Again, when you squeeze and lift, it's like you're trying to stop the flow of urine or stop the passage of gas. And you repeat that 10 times as quickly as you can. That's going to give you more control. And then in terms of strength, we're going to work on what we call elevators. So you're going to feel your pelvic floor squeeze, and you're going to pretend you're squeezing as if you're closing an elevator door. Then you're going to lift that pelvic floor muscle up to the first floor, lift it again to the second floor, and then again, keep squeezing and lift it to the third floor. Then in reverse, drop to the second floor, drop to the first floor, and then to the lobby. Repeat that 3 times. Some exercises that we do from there. So abdominal bracing. And these exercises will all be sent out to you after the presentation. So I'm just going to run through them and you'll see what they look like. And then you can concentrate on them more when you receive the recording. This one is specifically postpartum exercise that we use for progression, with starting with toe lifts and then marching. And this is our clamshell exercises, working again more on the abdominal brace and testing the abdominal wall. More progressions. So as I mentioned before, using the arms and legs to extend away from the body or rotating at the trunk can increase the difficulty of the exercise and make it a little bit more challenging. So everybody talks about flat abs, and this is a social media thing postpartum. And so in terms of if your goal is flat abs, you can be frustrated easily by doing millions of sit-ups and crunches and having it not work. And in fact, actually having more of a pot belly or a pouch after you do the exercises for a period of time. So we recommend very specific exercises, avoiding sit-ups and crunches. A lot of the breathing exercises that we've just done. in addition to some aerobic low impact exercise that will help with the co-contraction of the abdominal and pelvic floor. Exercises to avoid, like we just said, the crunches, sit-ups, and curls, hundreds, double leg lowered at the same time, and full push-ups or full plank. Not that you have to avoid these forever, but until you start to get the muscles working and returning more to a normal level, then these are the things you want to avoid. All right, so now we're going to talk about another symptom, postpartum and during pregnancy, restoring urinary function. So urinary dysfunction is a common symptom following pregnancy and delivery. And while these changes are common, they're not normal. This module allows you to identify different types of urinary dysfunction and teaches you how to address it through habit modification and exercise. So in terms of ACOG, the American College of Obstetrics and Gynecology, they have identified postpartum complications that physical therapists work with. And one of them is urinary incontinence. And you can see there that the incidence of urinary incontinence is at 3 to 40% at 3 months postpartum. You can see the other symptoms there as well. So this was data that was reported by ACOG in 2018. We're going to talk more about these as we move along. First, urinary incontinence. So 3 types of urinary incontinence we'll address. There's more than that, but we'll address the 3 most common. So that's urge, stress, and mixed. So urge incontinence is a strong urge to urinate, even though the bladder's not full. Stress incontinence is leakage that occurs with jumping, coughing, laughing, lifting, yelling. And mixed incontinence is a combination of the 2. 1/4 of all women over the age of 18 experience incontinence, and more than 33 million Americans have urinary incontinence today. And urinary incontinence costs us about $66 billion a year annually in the United States. More than 80% of urinary incontinence cases can be cured or improved with treatment. So if we look here at examples of the bladder, this would be normal function of the bladder, where the bladder stays relaxed, the urethra is contracted and closed until the patient is ready to empty their bladder. In the second instance here, we have urgency incontinence. So that's when the bladder muscle contracts before the patient is actually able or ready to empty. And stress incontinence is when there's a downward pressure that's pushing around the urethra, and the urethra is too weak to stay closed during that period of increased pressure. It's very common to notice changes in your bladder habits after you give birth. Even during pregnancy, most people experience some level of change. Some of these changes include increased frequency, urgency, or leakage, especially with coughing or sneezing. And the involuntary loss of urine is common in the postpartum phase and doesn't need to be a symptom you'll always have after having a baby. Stress incontinence, particularly, is related to the increased pressure in the abdomen, as we mentioned, and it responds well to exercise. Habits that can make your symptoms worse with stress incontinence include hovering over a toilet instead of sitting down, stopping and starting midstream to do pelvic floor exercises, trying to force the flow of urine, or going to the bathroom just in case, especially at night. One of the exercises we teach for urinary incontinence is the knack. So this exercise is training your pelvic floor to engage and support your bladder before there are any increases in pressure. For example, if you feel you're going to sneeze, cough, laugh, or you're moving from sitting to standing or lifting something heavy. So first you practice by engaging your pelvic floor muscles. Imagine that you're closing the openings of your pelvic floor, again, as if you're trying to stop the passage of gas or stop the flow of urine. And then you're going to lift your pelvic floor up and in, preferably as you exhale. You can add some abdominal muscles as you do this, and that will gently Pull your belly button towards your spine so you engage both at the same time as we did previously. And then to really put it all together, you can scoot forward to the edge of your seat. Take a breath in as you, take a breath in, and as you exhale, engage your pelvic floor and abdominal wall, and then stand up. Once you are standing, then you can breathe out and relax your pelvic floor completely before trying the exercise again. Second type of incontinence is urge related. This is a sudden need to go to the bathroom. And this type of incontinence also responds well to exercise and behavioral changes. Other names for this condition that you may commonly hear are overactive bladder, bladder spasm, spasmodic bladder, irritable bladder, and detrusor instability. So ways to control urgency. When you feel the urge, you take a calming breath. So again, that belly breath, breathe in deep, and then do 5 to 6 quick Kegels. When your pelvic floor contracts, it tightens the muscles and it tells the bladder not to empty. So it's actually changing the mechanism there. Other people may tell you to cross your legs or put pressure on the perineum. That's the area between your vaginal opening and rectal opening. And you can also distract yourself by counting from 10 slowly down to 1. With urgency, a lot of overactive mind stimulation or thinking makes the urgency worse. So in all of these instances, we're trying to calm the nervous system and decrease that sensation of urgency. Tips for new moms. In terms of bladder habits, only go when you need to, particularly at night. So you're gonna, instead of every time you go out the door or every time you go past the bathroom, you're gonna wait until you really feel the need to go. That should be about 5 to 7 times a day and 0 to 1 time at night. You want to make sure you're drinking plenty of water. So we typically say about 60 to 80 ounces a day for anyone, but with new moms, if you're breastfeeding, it's definitely going to be more fluids. And you want to avoid constipation, which can put excess pressure on the bladder. Other tips, you want to sit on the toilet with your feet firmly planted on the floor, and you don't want to strain as you try and empty your bladder, no pushing, and you don't want to hold your breath. Other things that you can do are avoid irritants. So these are some common irritants, and I have a list for you. If you find that one of these things is in your diet, seems to be associated with about the time you developed urgency, you can eliminate this from your diet for 3 to 5 days and see if it has a change in the level of urgency that you feel. There's also medications or like vitamins or other substances that you take, including alcohol, that can have an effect on urinary incontinence related to urgency. All right, so let's talk about constipation. So in terms of constipation, this can be a common result of prenatal, postpartum, and breastfeeding, right? Constipation's been linked to an increased prevalence of pain, hemorrhoids, urinary incontinence, incomplete emptying, and weakness of the pelvic floor. This module will explain why addressing constipation is so important and how to identify it and what you can do to promote better bowel health in your daily life. So this is the digestive system. Nice picture here. The digestive system runs from your mouth all the way down to the anus. In pregnancy, there's displacement of the organs and tissue. And as you would expect, this can definitely affect our bowel habits. If we look specifically at the pelvic floor muscle, we can see that the bowel or rectum passes through the pelvic floor. So if we look here, pelvic floor, we can see the passage through. The pelvic floor muscles contract to stop the passage of gas or stool, and they relax to allow the bowel to empty. Constipation often develops in the postpartum period as the body's adapting to the many changes. Sometimes we'll see that bowel movements can become uncomfortable and even infrequent during this time. The right frequency for bowel movements typically can be 3 times a day to every 3 days. Some of the causes of constipation, so not having enough water in the body. You can, for example, eat lots of fiber without drinking enough water, and that can lead to constipation. The fiber in your stool needs water in big enough amounts for you to be able to pass stool. Absence of fiber in the diet, so if the fiber isn't digested in the body, it can make your stool bigger and easier to pass. Routine changes, so changes to your normal routine can affect your bowel movements. You probably see that when you go on vacation, you travel, or you have a lot of stress in your life, you may see definite changes in your bowel movements. And when you're pregnant, the growing baby puts pressure on your intestines. It also reduces activity, and the changing hormone levels because of pregnancy can cause constipation from time to time. There are also some medications like narcotics and antidepressants and antihypertensives that are known to cause constipation. And in terms of aging, so as you age, your intestinal muscles lose some of their strength. Another reason for constipation and aging is a reliance on more medications. Another way that we can cause constipation is by ignoring the urge to go to the bathroom and have a bowel movement. So if it's not the right time, it's not the right place, your body then stops recognizing that message as easily as it may have previously. And that can change the way that you feel in terms of being able to easily empty your bowel. Exercising, so if you're not exercising or you lack exercise or you have restricted movement, that may make you more constipated. And then irritable bowel syndrome. So constipation is one of the signs of irritable bowel syndrome. And general hospitalization. So if you're on bed rest, common cause of constipation, change in the routine, less food, less drink, potential pain from any surgery that you had, and use of pain medications like morphine. Causes of postpartum constipation. So bowel movements begin to resume a few days following delivery. However, a few issues may cause problems as your digestive system returns to normal. Some of the causes, particularly with postpartum constipation, we mentioned hormones, hemorrhoids, iron supplements that you're taking, a painful episiotomy site or tear, and damage to the anal sphincter. Other symptoms of constipation include painful passing of stool, passing small, hard, or dry stool, having diarrhea or bowel urgency, feeling like your bowel's not empty even after you go, a bowel movement causing you to strain hard, taking longer than usual to pass your stool, bloating, and cramps or pain in your stomach or intestine. So what does constipation look like? So we use the Bristol stool chart to describe our bowel movements. The goal is a Bristol 4. So when we're constipated, we're going to be more like a 1 or 2, maybe even a 3. And as you can see in this picture, stool is too hard to pass, right? And with this, when we're constipated and we're a 1, 2, or 3, it's our body telling us that we need to add more water and more insoluble fiber to our diet. Insoluble fiber is going to be food that is your dark greens and your dark browns. When our stools are loose, like a 5, 6, or 7, We have water in our system most likely, but we need to add more soluble fiber, which helps bulk up our stool. Think of white foods like rice, pasta, potatoes, bread, popcorn, bananas. Those are all good things for a 5, 6, or 7. Again, tips for postpartum constipation specifically: lots of fluids, eat your greens, the right type of fiber, plenty of insoluble fiber or natural, what we call a natural laxative. Having magnesium in your diet, so magnesium allows for easier bowel movements, and a warm liquid every morning to kind of start your day. So complications of constipation can be what we call a rectal prolapse. So this is caused by repeated straining or trying to pass stool that's hard, and it causes a part of the rectal lining to actually protrude out from the anus. Can also have fecal incontinence. After some period of time, your intestines may not be able to get rid of all the waste when you're constipated. So it can become full, and some of that stool will start to exit by itself. Urinary incontinence. So constant straining while you're emptying your bowel will weaken your pelvic floor muscles, and this can cause passage of urine, especially when you sneeze, laugh, cough. Hemorrhoids, so straining too hard to empty your bowel may damage the blood vessels around the rectum and cause hemorrhoids or bleeding. And then fecal impaction. So this is when the rectum is so full of stool that the muscles of your bowel are unable to push it out. Prevention and treatment of postpartum complication. Other tips besides food and drink we already talked about. So managing that intra-abdominal pressure. Don't hold your breath and push. Make sure you breathe. Make sure you work on the diastasis. Pelvic floor relaxation. So if you can learn to relax your pelvic floor muscles and easily let your bowel movement empty. You can use yoga and stretching. We'll show some pictures of that. It can also be some manual therapy, biofeedback, which we won't talk about today, but that's definitely a technique for this. And then we'll review the 10 tips for easier bowel movements. So in terms of getting your bowel movements correct, 1, manage your stool consistency by altering your food and water. 2, ensure that fluid intake is where it should be. 3, have that breakfast and a warm drink first thing. 4, obey the urge to go. Don't turn it off. 5, take sufficient time to empty. So you want to be relaxed and have sufficient time to empty. 6, the correct position. So you've heard of the squatty potty. We're going to look at that next. 7, correct technique. So there's a technique that we teach that makes you kind of make your waist wide and then be able to bulge to empty. There's some pelvic floor exercises we recommend, and then some pelvic floor relaxation exercises. So here's the picture of the squatty potty. Probably seen this. Many stores carry it. A lot of people talk about it. A lot of people don't talk about it, but they have one. So in terms of the squatty potty, what it does is it elevates your knees above your hips, which allows the muscle that goes from the pubic bone around the rectum. It allows that muscle to relax so that you can easily empty your bowel. So if you see here without the squatty potty, this is kind of like a horseshoe around the rectum, tight, and it doesn't allow it to empty. Here you can see it loosens the muscle, allows kind of a straight shot to empty. Some exercises, as I mentioned, yoga exercises, stretching exercises. These are some great positions for constipation to kind of get our GI system moving. All right, we're going to talk about return to exercise. So returning to exercise is an important part of wellness and postpartum recovery, but it can also be overwhelming as you're trying to heal and care for a newborn. So in this little module, we're going to look at exercise where it's recommended, contraindicated, and provide tips to help you incorporate physical activity into your schedule. I'm just going to show you these exercises again. These are things that you'll be able to see in the recording. So first exercise here is just a simple breathing exercise again. And then progressing into some of the pelvic floor exercises. And then some core strengthening exercises. Again, the march progression, the clamshell, and then more hip exercises. Then we start to progress into some walking and some aerobic exercise, as we mentioned earlier. Some yoga stretches, and that covers the exercises. In terms of prolapse, so a symptom of postpartum, right? So of pregnancy and postpartum. So pelvic organ prolapse is a condition in which one or more of the pelvic organs, including the uterus, bladder, or rectum, shift from their normal positions and create a sensation of pressure or heaviness in the lower abdomen or pelvic region. Pelvic organ prolapse commonly occurs with pregnancy, and it's caused by those weak or strained muscles, ligaments, and connective tissue. This module is going to review behavior modifications and exercises, which can reduce the risk of repeat prolapse or the need for any kind of surgery. So in terms of a prolapse, again, umbrella term for the descent of those pelvic organs. It occurs when there's a weakness. Person might feel a fullness or a pressure, and typically worse with gravity. So when you're standing, typically feels more uncomfortable. In terms of symptoms, people commonly report the heaviness or pressure, a sensation of a bulging or something falling out, typically vaginally or rectally, difficulty emptying your bowel or your bladder, and then urinary incontinence. So the internet is full of lots of scary information about pelvic organ prolapse, and that leaves new moms anxious and feeling defeated about this. Prolapse is very common with delivery, and prolapse can be corrected, right? You can take action and steps to feel better and keep your body healthy as you age. So prolapse may not happen immediately with delivery, but maybe years later, as the muscles are weak, as there's multiple pregnancies, as there's lack of exercise, all kinds of things can contribute to the ability of the body to have a prolapse. So biggest risk factor, not a surprise, for developing a pelvic organ prolapse is vaginal childbirth. Can also increase the risk with forceps or a vacuum delivery, and each subsequent childbirth can increase the risk. A C-section, people think that that's protective from having a prolapse, but not necessarily, as pregnancy alone can cause that weakness. Other reasons for prolapse can include constipation, pelvic surgery, genetic factors, generalized connective tissue disorders, obesity, and people who do a lot of heavy manual work as they age tend to have more of a prolapse risk factor. Again, reducing that intra-abdominal pressure. So simply being able to exhale as you do hard work can reduce the amount of prolapse. And being mindful of that increased intra-abdominal pressure in your everyday life is important. So the appearance of a prolapse, if you used a mirror and you took a look at your pelvic floor, so if you're maybe sitting on the toilet or laying on your bed, you can take a hand mirror and look at your pelvic floor muscles. And what you might see is a bulge coming down towards the vaginal opening. Depending on the severity, the bulge may be obvious or it might be very hard to see. And if you hold your breath and do like a curl up or a push, you might see more of a bulge that moves down towards the opening. So this is a picture of a uterine prolapse. So this would be when the uterus, this would be a normal vaginal opening. And if you had a uterine prolapse, you'd see something like this. This would be a rectal prolapse, a rectocele. So this would be a normal vaginal opening, and this would be when you have a rectal seal. And then this is a picture of a cystocele, so that's a bladder prolapse. So this would be the normal, and then this would be if it's a bladder prolapse. So how can you reduce symptoms? So pelvic floor muscle exercise is the first treatment recommendation for pelvic organ prolapse. We establish solid pelvic floor strength, coordination, and mobility to keep the pelvic structure strong, and that can prevent prolapse as you age. We have pelvic floor muscle strengthening, and it's more than just doing Kegels. So people typically tell you to do Kegels. A lot of people don't perform them correctly, or they are not the right exercise for you. Pelvic floor muscles need strength, but they also need to be flexible. So we like to think of them as a trampoline, so they should easily contract and let go. We work a lot on that. And then there's research that shows, like I said, that 50% of women don't perform Kegel exercises correctly. So it's always good to have a provider like a pelvic health therapist who can help you identify if you're using the right muscles and if you're using them correctly. Again, manage the pressure in your body. So exhaling as you do heavy work, improve your toilet habits, don't strain, don't push. And then pessaries can offer some structural support. Topical estrogen sometimes is indicated. And then, of course, there's always surgical repair if needed. Again, preventing that pelvic floor injury overall. Exhale as you push with childbirth, if possible. Take steps to reduce the severity of perineal tears. So sometimes we'll do things like perineal massage. Support your body as you start to recovery postpartum, and then be intentional with your movement. All right, let's talk about return to intimacy postpartum. So for many, returning to intimacy postpartum can be overwhelming and again, produce anxiety. This module covers how changes in the body may contribute to dyspareunia or painful intercourse, and how low libido, and what you can do to improve your readiness and comfort level for intimacy. So we hear this a lot. After having a baby, new moms are busy, they're caring for their children or a child, they're sleep deprived, they're going through hormonal changes, and they have common postpartum physical symptoms such as pain or weakness. Many new moms also report sexual dysfunction. These are common comments that we get from our postpartum moms. Many doctors will recommend waiting until about 6 weeks postpartum to return to intimacy to allow for healing. During that 6-week period, the incisions or tears are being repaired. The uterus is starting to involute or become its normal size. We talked about how much bigger it was during pregnancy. The vagina also involutes at about 6 to 12 weeks, and vaginal discharge decreases over the first 3 to 6 weeks. So some physical changes that you can expect: vaginal soreness or dryness, spotting from the cervical lining, which is still healing, nipple soreness or breast engorgement, and cesarean incision or pain or numbness. How common do women experience difficulty returning to intimacy? So painful sex, 50% at 3 months, 16% at 1 year. 40% experience painful sex at 6 months, and this can happen regardless of natural or cesarean birth. Why does it occur? Again, from the strain on the pelvic floor during labor. There's lots of pressure over the 40 weeks as well. In all cases, even normal, uncomplicated, and quick delivery, you can have these symptoms. They can be compounded by perineal tearing or the C-section delivery. And just like any other part of the body, give yourself time to let the muscles and tissues heal. Lack of lubrication. So as estrogen levels drop dramatically within the 24 hours after birth, your other hormones are also changing. This can cause the vaginal dryness, as well as other symptoms. And then low sex drive. Why does it occur? Again, hormone change, lack of sleep, all the other things that go into this. There's a part of your brain called the amygdala that's taking over the process of caretaking. Everything else can just create that like added pressure and low sex drive. And then altered body mechanics. So why maybe is our posture not great? Why are we having difficulty performing activities such as exercise? We can have all kinds of dysfunction that's occurred or inflammation that's occurred in the body with pregnancy and delivery. So what can you do to set yourself up for success? You can use water-based lubricants when it comes to intercourse. That offsets the reduction in estrogen and resulting dryness. You can position yourself correctly, in control, use honest communication with your partner, talk about what feels good and what doesn't, increase foreplay, and use a balm, a perineal balm, with cooling properties or cold compress afterwards. Can also work on scar mobilization for your cesarean or perineal scars. Stretches, pelvic floor muscle exercises, strengthening, and aerobic exercise. Same thing as we saw with all the other modules here today. So here's some stretches for intimacy that we particularly use. And then in terms of scar mobilization, again, this will go to you, you'll get this, but this gives you some ideas in terms of how to perform scar mobilization. Reason we have to perform that for some people, they have decreased mobility in the tissue and that creates pain. And then this is for the C-section scar. All right, general tips. If you're currently pregnant, exercise and stretching is an excellent way to prepare your body for delivery. You can march in place, do lunges, side shuffles, standing trunk rotation. You can do stretching of your hamstrings, your hip flexors, your hip adductors, any muscle around the pelvis. Listen to your body. Use the bathroom before you exercise and avoid lying flat on your back. Other tips, wear a sports bra that fits well and gives you support. You want to breastfeed or pump before exercises if it's postpartum. Be sure your sneakers fit well, drink lots of water, and warm up and cool down appropriately. And then healing after childbirth, things to know immediately after childbirth that you can do to help the recovery process. So know the details of your labor and delivery and what happened during it. Be careful about your personal hygiene. You can use ice and compression for 48 hours after delivery. You can take pain relief as needed. Your gentle pelvic floor contractions can start day one. So these aren't hard and fast. This is more recognizing where those pelvic floor muscles are, because you probably don't have great sensation and you may not be able to actually feel the muscles contract. So very, very gently. You can rest and eliminate gravity positions. Again, that reduces the incidence with prolapse. You can improve or be careful with your posture. Remember the soda can. So after a pregnancy or a C-section, that posture is going to be kind of slumped forward and down. So improve your posture. Be careful with your sitting positions. Use support pillows. Be mindful of your movement. Don't overdo it. Avoid constipation and straining. Find those muscles by doing those exercises. Breathe and relax. You can use self-massage for scarring and return to pain-free intercourse as appropriate and return to exercise safely. Don't overdo. In terms of postpartum pelvic floor physical or occupational therapy, so all moms are eligible to see someone during pregnancy as well as postpartum. Ideally, an evaluation takes place during pregnancy so that we can give you a plan for the postpartum period. However, it's never too late to see a pelvic floor therapist. Even up to many years postpartum, we get people 20, 30 years postpartum who are looking for help with these symptoms. Okay, question.